Hi, I'm Dr. Diehl, the founder of the Complete Health Improvement Program, the CHIP program, and a clinical professor in the School of Medicine and Preventive Medicine at Loma Linda University in California. Once considered to be a death sentence, diabetes is the mother of all chronic diseases because it takes your body down one organ at a time. And yet it doesn't have to be that way. You feed it or you reverse it by how you use these tools. Are you ready for this? Let's take a look at it. Here's your diabetes alert. It's estimated that every second American adult today either has diabetes already or is a pre-diabetic on the way of developing the full-blown disease. Moreover, 1 in 10 healthcare dollars is now spent in treating diabetes, and 1 in 5 healthcare dollars is spent in caring for diabetics. It's a $245 billion industry, and yet there's no cure. But we have symptomatic treatments. Isn't there a better way to do it? Here you see some of the emerging trends. 1994, about 5% of the American adults were diagnosed with diabetes. 3 years later, 6%. 3 years later, 7%. 3 years later, 8%. 3 years later, 9%. And now it's more than 10% of the American adults are diabetics. And it runs parallel to the emergence of obesity in our society. Here you see some of the data, the trends. 1995, 10% of the American adults are obese. 5 years later, 15%. 5 years later, 25%. Now you come to 2010, more than 30% of the American adults are obese. You see the connection? Diabetes is 7 times more frequently found among obese people, especially those that are very obese, than those that are at a more ideal weight. And this disease is escalating at 5% every 5 years. Here you see the graph. Look what happened since World War II, and especially in the last 20 years, a dramatic increase of 300%. As a matter of fact, diabetes has been inexorably advancing, doubling every 15 years, and a baby born today has a 1 in 3 chances of developing diabetes in a lifetime. What are the numbers? More than 30 million Americans have diabetes, and another 86 million pre-diabetics on their way to diabetes. How do we define diabetes? Well, it has to do with numbers. It's the amount of blood sugar that is measured, and once that is over 125, we usually consider these people to be, by definition, diabetics. A normal blood sugar usually is about 100 or less. But once you get to the 100 to 125, these are then the pre-diabetics on their way to diabetes. If you don't know your blood sugar numbers, what are some of the things that you can watch out for? You know what you look out for, don't you? You have to worry about increased thirst. You drink more water, so you go more often to the bathroom. You have increased hunger, blurred eyesight. You have this tired feeling, and you have tingling in your hands and your feet. And then for men, they usually begin to realize that there's something not quite working very well below the belt line. Sexual dysfunction. The other aspect of what diabetes does, it increases the acceleration of atherosclerosis, a gradual narrowing of the arteries in the body. And so with that, you have to worry then about blindness, the arteries in the back of your eye. The number 1 cause of blindness is diabetes. Number 2, you have to worry about kidney disease. Kidney disease is 18 times more frequently found in those that have diabetes. Then you have heart disease and stroke, 2 to 4 times more frequently, impotence in men, foot and leg amputations. Again, diabetics are the number 1 people that have to worry about amputations of feet and arms and legs. And then also you have hearing impairment. So here's a concept here, and it suggests to you that nerve damage and vision loss, kidney disease, amputations, heart disease, diabetes-related deaths, all of these things are directly related to the level of blood sugar that you have. The higher the blood sugar level, the more likely you develop these kind of diseases. The risk increases with the level of blood sugars. But it's not just these diseases. You also have to worry about how long do you live. Here you see the effect on life expectancy. Men probably give up 10 to 12 years of life, and women 14 to 15 years. So this is a devastating disease. But this is not enough about the bad news. Let me give you some good news. Here it is. Some 50 to 75% of type 2 diabetics on insulin and 80 to 90% of those on pills could actually normalize their blood sugars and be off medications within weeks. And all they have to do is change their diet. How do you use those special tools, fork and knife? To understand diabetes, it's important that we understand insulin. Insulin is produced by the pancreas, and the insulin has one major function, and that is to open up the cellular gates, the doors that, when they're opened up to the cell, would allow the blood sugar to be ushered into the cells so that it can be used as energy to run the body. Here you see what happens to a person without diabetes. There's a pancreas, it produces insulin, and it's being ushered to the different cells of the body, and it now has the function to open them up so that the glucose in the bloodstream can enter into the cell where it's needed. That's how it works in a person without diabetes. Then you have a type 1 diabetic. Here you see no pancreas. I mean, the pancreas is there, but it doesn't work. It doesn't produce any insulin, and because it doesn't produce any insulin, it cannot open up the cellular gates, and the glucose molecule is building up on the outside of the cell in the bloodstream, and the person now moves towards complications in terms of organ diseases. Now, what about type 2 diabetes? Well, that's a different kind of diabetes altogether. Here it's not an insufficiency of insulin, because most of these diabetics, when they're discovered and diagnosed, they usually have plenty of insulin. It's not a lack of insulin. What we have here is that the insulin is not effective in opening up the gates. Here you see the picture. You have a pancreas, it's overactive, it's producing lots of insulin, but the insulin somehow is not able to open up all the gates of the cells, and so what happens next is that the blood sugar begins to build up more and more and more. The reason then is the insulin is no longer effective, it is somehow affected by some gumming up of the locks. Gumming up of the locks, an interesting concept, isn't it? As the insulin is no longer effectively working because somehow the locks are gummed up, the key doesn't work anymore to do the job, the pancreas is trying now to compensate, and it produces more and more insulin in trying to open up those many locks on the cell. As a result, in due time, the pancreas actually burns itself out. It fatigues first, then it burns out, and then the person has to depend on getting insulin from the outside inside. And the person now becomes insulin dependent. It's just like the type 1 diabetic who has no insulin and is dependent on insulin from the outside, insulin injections. When it comes to diabetes, we usually differentiate between the type 1 and type 2. You see here the relative importance of these types, but then you also have gestational diabetes that can happen during pregnancy. How do we treat diabetes in this country? Here you see the distribution of medications. 3 million diabetics are on insulin, 13 million are taking pills, then you have another 2 million that are on insulin and pills, and then 3 million are trying to use a diet, which doesn't really work very well either, because the advocacy here is to use a high protein diet, which actually makes it much more difficult for the kidney to stay healthy. So what we understand then is drugs don't cure nor stop the epidemic of diabetes, and they may actually be harmful because many of these drugs actually cause weight gain. They enhance your appetite, and as your weight goes up, you need more medication. As you need more medication, you will gain more weight, and you're in this vicious cycle. So medications, they may have their place in some ways, but they're not really the cure. So if some of the people that are placed on diets, if they don't do very well, what kind of a diet should we really be using? And I think we can learn some lessons here from population studies. Let's take a look at this. Diabetes is very rare in populations on traditional plant-based diet, but it usually becomes much more common as a diet becomes westernized. Let's take a look at Japan. 1960, very rare. Less than 1% of the Japanese have diabetes. 20 years later, it's now 6 to 12%, and today more than 15% of the Japanese in the age range of 40 years plus are now combating diabetes. What happened in Japan? Well, they began to use these instruments, these tools differently than before. And as a result, you see a dramatic change in the rates of diabetes. Take a look. Here you see a decrease in the carbs. No longer do they want to eat those carbohydrates, the starchy foods, the rice and so on, but instead fat is taking over more and more now. Processed foods come in, animal products come in, and you see a significant alteration in the relative use of fat and carbohydrates, starchy foods. And with that, you also see a significant increase in the obesity. You see the red line. And quite parallel to this, amazingly, you see the increase in diabetes. But this is not only happening in Japan, this is a worldwide phenomenon, because as the GDP, the gross domestic product, the income of society increases, so does the diet change. We're using fork and knife differently. For instance, we're now refining our food. We used to eat potatoes, now we eat potato chips. A huge change, because now you have dramatically increased the amount of fat in that product. And with that, you have significant effects on how the body works. As a matter of fact, we could also give you some other examples. Over 50% of our calories come from refined, processed, engineered foods. And another 35% come from animal products. And please note, only 14% of the calories that we eat actually come from whole foods, such as fruits and vegetables, whole grains, legumes, and maybe a few nuts. Our diet has totally changed. This is what we eat. This is the American diet. Totally refined, totally processed. These are no longer foods as grown, but these are foods that are being made for us to consume for convenience and for taste. And so then the question sometimes is asked, well, tell me, what is really gumming up these locks? Does it have to do with the diet as you're suggesting? Let's take a look. Is it a disease that has to do with sugar consumption and starch consumption, which turns into sugar, or is it related to the fat in the diet? Let me tell you a little story. The story goes back to 1927. Dr. Sweeney is putting 100 of his healthy medical students on 2 different diets to see the effect on blood sugar levels. One group gets a high-fat diet, like 65% of the calories comes from fat. That's about twice as much of what we eat, and our diet is high in fat already. So this is a very high-fat diet in one group. The other group he feeds sugar and pastry and candy, white bread, bananas, baked potatoes, brown rice and oatmeal, the very foods that we usually don't want to see diabetics eat. And when he takes a look 2 weeks later, he's absolutely shocked, because the group on the high-fat diet has the high blood sugar levels. Within 2 weeks, they're testing diabetic, while the group that is on the high carbohydrate diet, the sugars and the refined and whole starches actually are doing relatively well. And the question now is, well, are you suggesting that maybe diabetes comes not from the sugar bowl, but it comes from the fat diet? Well, come on. I mean, do you think that we have missed it all these years? Well, let's take a look at what the science is telling us. Here are the experiments of Dr. Himsworth, a famous physician in England. His control experiments showed that the more fat in the diet, the lower the patient's sensitivity to insulin. The blood sugar levels changed in response to the amount of fat in the diet. The more fat, the higher the blood sugar. The less fat, the lower the blood sugar. Really, really. Then there was this huge study called the DPP study, the Diabetes Prevention Project. They took 3,000 some obese pre-diabetics. They followed them for 3 years, and they wanted to see how many of these people become full-blown diabetics. And here's what they did. They had 3 different groups. One group, they just lived the way they used to live, and 29% of these pre-diabetics became full-blown diabetics within 3 years. Then they used the most popular medication used for the management of blood sugar levels, and they did fairly well. Only 21% of these people became diabetics. But then they compared it to the group that was placed on a lifestyle program. You know, they were supposed to lower their weight somewhat, and they were supposed to walk 150 minutes a week. I mean, that's not a very big lifestyle program, but they did. Even these modest changes made it happen that only 14% of these pre-diabetics became full-blown diabetics, which means that the lifestyle program was much more successful than the program that used the most popular medication. Well, we can take you to Harvard. There are 200,000 people that they followed up for 10 years, and they found that 2 ounces of processed red meat a day actually increased the diabetes by 50%. You mean a diet with processed red meat can actually increase diabetes? Yeah, because these kind of diets are usually fairly high in fat, and there's some other aspects to a high meat diet that can cause problems for the body. The last study that I want to cite here is the study that comes from Loma Linda. This is the Adventist Health Study. It's a study that has 100,000 Adventist people enrolled in North America. And as you may know, some of the Adventists are vegetarians, some of these people are vegans, and some of these people are meat eaters. They're pretty much living a very homogeneous lifestyle in most areas, but when it comes to diet, they have some differences there within their faith community. And here's what they found. They found that those Adventists that were meat eaters had 4 times more diabetes than those that were pure vegetarians. Here you can see it. You see, there's a stepwise progression downward. The more you move towards a pure vegetarian, sort of a vegan diet, the lower the rate of diabetes. So I get the idea that a high-fat diet is not advantageous for people that have diabetes because, for one thing, it contributes to weight gain, which is not in the best interest of managing diabetes, and also it seems to have, apparently, an effect in gumming up the locks of the cell. But I don't understand this issue of carbohydrates. How come Dr. Sweeney, feeding these medical students a high-carbohydrate diet, did much, much better than those on a high-fat diet? Well, what we need to do is we need to understand carbohydrates. Not all carbohydrates are equal. There are some carbohydrates that are refined carbohydrates, they have no fiber, and then there are carbohydrates that are naturally coming to us like this, they're unrefined, and there are lots of fiber there. And the fiber is really the magical ingredient, because fiber slows down the conversion of the starch into sugar. So let's take a look at this carbohydrate chart. You have simple carbohydrates, the sugars, and you have complex carbohydrates, the starches. What is really important is not that some of them are simple and some of them are complex. What's important is, are they refined or not refined? Are they processed or unprocessed? Because you see, unprocessed starch-rich foods are protected by soluble and insoluble fiber. Just to rephrase it, fiber slows down the digestion and absorption of sugars and starches. These are the kind of foods that you want. However, when you have processed starch, look at it. It turns into sugar because it doesn't have any fiber. So refined carbohydrates are unprotected. They can be broken down and absorbed quickly. They become like sugars, and they're raising the blood sugar levels. So use these kind of refined carbohydrates rarely. And when, then eat them with high fiber foods to slow down the absorption. Can I really reverse this disease? Well, we talked about the causes. Let's talk about the cures. Number 1, if you want to reverse diabetes, move towards a low-fat diet. Here's study number 1. A physician in Montreal. A 5-year study, 100 diabetics on insulin, 24 are off insulin within weeks. How? By moving towards a high carbohydrate diet, but unrefined, protected kind of carbohydrate foods, very low, of course, in fat. Here's study number 2, a study by Dr. Inder Singh. Now, this is years ago. He took 80 diabetics on insulin. He gave them a very simple diet of natural foods, 11% fat. And within 6 weeks, 50 of these 80 diabetics were off insulin. That's a 62% success rate. Amazing. You can turn this disease off, you can turn this disease on. It all depends how you use fork and knife. Study number 3, Dr. James Anderson, professor at Kentucky University. Here's what he did. He took 28 diabetics and he fed them a very simple, low-fat, high-carbohydrate diet, but the right carbohydrates. And within 3 weeks, all of these diabetics were off the insulin. You can turn this off and on. It just depends on how you use those special tools. And here's study number 4, the Pritikin program, low-fat program natural foods, 44% of patients with type 2 diabetes were able to stop their insulin within 4 weeks. And 74% of patients with type 2 diabetes on oral drugs were able to leave the center drug-free within 4 weeks. It happens very fast. And then you have study number 5 by Dr. Diehl Barnard. The same kind of a program, same kind of a diet, low in fat, low in refined foods, more whole foods, plant-based. And here he finds 71% of his patients with type 2 diabetes were able to stop their oral medication in a 26-day program. And then you have one more, I should mention this, the CHIP program. And I know that some of you may have been wondering whether we had some success with diabetic patients among our 80,000 graduates. And here you find what happened to these diabetics in our group. This is a major study. 525 people are identified with diabetes, and after just 4 weeks, there are only 390 out of the 525 that are still diabetic in terms of their blood sugar levels. This is incredible documentation and validation that moving towards simple foods, foods as they are coming to us in nature, can be very powerful, partly because of their high fiber content, and then also because their fat level is so low. Perhaps I can give you an illustration of what happens to patients with diabetes that are following a CHIP program. Listen to Dr. Greenlaw, one of our medical directors in the CHIP program.
Hello, I'm Dr. Roger Greenlaw, and I would like to share with you a story from my practice. We'll be hearing about the health benefits of a high-fiber diet in a 76-year-old woman with multiple lifestyle-related diseases.
It had started several years ago, maybe 25, 30 years ago. I began gaining weight. That's the first thing I noticed. And with that weight gain, I developed some high blood pressure, and soon the doctors were talking to me about high cholesterol. And not too long after that, I started to develop what I thought were cardiovascular symptoms. I was very, very tired. I couldn't walk very much of a distance before I had to sit down. I would be out of breath. Very soon after that, I developed symptoms of diabetes. After several years of that, I started to have even more complications that come with high blood pressure and diabetes. I started to have eye problems, what they call diabetic retinopathy. So I did go to a nephrologist, and he suggested that my kidney function tests indicated that I was going into kidney failure. In fact, I was at stage 4, which sort of puts you right at the edge of needing dialysis and or a kidney transplant. Finally, one Sunday, I lost vision in my right eye, and at the same time had a problem with my right arm. There was some pain there, and I couldn't use it very easily. So then they ran more serious tests and finally did an angiogram. And at that time, they found many, 7 or 8 blood vessels that needed to be replaced, and then went out to tell my husband and daughter they would have to do open heart surgery and take veins from my leg and replace those blocked blood vessels in my heart. And they did that in short order. In addition to what I saw as very serious health problems, I did start to develop some digestive problems along the way. And I took some over-the-counter type medications for that, and it didn't seem to help much. So by the time that I made an appointment to see Dr. Greenlaw and talk about the colonoscopy, I also had many other digestive problems to discuss.
Now I would like to tell you about the medications that Beverly was taking. She was on 4 different medications for high blood pressure. One of them causes potassium to be lost from the body, so she was also taking a potassium supplement. In addition, she was on a trial of Lipitor for cholesterol elevation. Let's focus for a moment on Beverly's diabetes. She was insulin dependent, not only taking long-acting insulin every day, but several times during the day, she required injections of regular insulin to control her blood sugars. And remember, she had complications of her diabetes.
I had so many things that I really didn't know what to work on next to try to keep under control. I was so worried about myself and how I was feeling and what I was going to do if this thing progressed, or if I couldn't get those kidneys under control, or if the veins that they had replaced the arteries with in my heart blocked again. So I really was in a hopeless situation, and I knew I had to make some firm decisions and life changes.
In our discussions, it was obvious to Beverly, and it was obvious to me, that she had exhausted all the traditional medical interventions that could help with her diseases and complications. She was asking me, what could I do that would improve my situation? Now, we talked about lifestyle change, her nutrition, her exercise, what stresses were going on in her life. And could she make some changes that might begin to address her diseases? And she was interested. I recommended that she try the CHIP program, and she agreed. As Beverly and I talked about lifestyle change, therapeutic lifestyle change, we talked about her multiple diseases and how the CHIP program could address all of those. The idea that if you treat one problem with a lifestyle change, you begin to treat all problems simultaneously that are lifestyle related. And that seemed like a perfect idea for Beverly's situation. Now for the really fun part of this story. Beverly signed up to take the CHIP program in September and October of 2009, and I would like to share with you some of her laboratory data. In the beginning, her cholesterol was 263, and after the CHIP program, it was down to 170. When we looked out 5 months later, it was 202, and a year after that, 178. It is not unusual for people's numbers to improve with some ups and downs over time, and she has continued to improve. Notice her weight loss at the end of the CHIP program was 15 pounds, 5 months later, 25 pounds, and then in February, a year later, 40 pounds off, and in June of 2012, 57 pounds off, and that's where she leveled out. Notice the dress size going from 18 to 16 to 14 and then 12, and now she's shopping in the size 8 to 10 rack.
Then I noticed that I could eat a great deal without taking more insulin. The other thing I noticed is I seem to be losing weight, eating more, but losing weight, and that gave me some encouragement. I think probably just in the first weeks, I lost 10 pounds or more. As I became more involved with the program, I noticed that I could get the blood sugar levels under control. That was a big thing for me. And I was feeling a lot better.
The big story here is that she's off insulin and controlling her diabetes with metformin and lifestyle change alone. And let's not forget that Beverly was suffering from severe complications of her diabetes. With the taking of the CHIP program, the laser treatments stopped, and over the next 2 or 3 years, not one laser treatment was necessary. Her ophthalmologist was stunned at that result because that is so seldom seen in traditional medicine.
Then the neuropathy, that was a problem. In the auditorium where we had our CHIP program, there were steps, and every time we went to our seats or got up to get water or have a break, we would use those steps, and I needed help a lot of the times because I couldn't feel the steps the steps themselves in my feet, with my feet. If I couldn't see them, I wouldn't know they were there. And so someone noticed and gave me some help when I needed to get up out of my seat. And now it's so different, because even if I change socks and I have heavier socks on or lighter socks, I can feel the fibers in the socks, and it was something I couldn't feel before. Just recently, the doctor checked my feet with the little wire to see how your neuropathy is, if it's progressing, and he could find no evidence of it at all.
Neuropathy is something most people would say is not able to be improved by medical therapy. You would use pain medicine to control the discomfort, but you would not expect neuropathy to go away. And in Beverly's case, her neuropathy steadily improved till it is now no longer an issue in her life. Incidentally, her heartburn improved within 2 weeks of starting the CHIP program.
I would have been happy before I started CHIP if any of the diseases that I've talked about would have been helped, even to any degree. That's how desperate I was. And now I see that not only the diseases were, some of them reversed, all of them improved, that's for sure, but it changed me as a person. I see myself sort of as CEO and president and chairman of the board of all the decisions that are made for my body, and do everything I can to make the right decisions day by day.
Well, maybe it's time for a new cow. Take a look at this picture. Yes, whole foods, plant-based. Let me summarize then. The prescription for type 2 diabetes then is a whole food, plant-strong diet that is offering the single most powerful and effective remedy to prevent and reverse type 2 diabetes. Do you remember I talked about Dr. James Anderson? Dr. Anderson wrote more than 500 scientific articles on diabetes and how to take care of it. He wrote about the high fiber advantage. And then at the end of his life, he comes up with this kind of recommendation. He says, some 50 to 75% of insulin-using type 2 diabetics and 80 to 90% of those on pills could normalize their blood sugars and be off medication within weeks if they changed their diet. An amazing journey, isn't it? Let me offer you a special gift today. Take a look. Concerned about diabetes? Then claim your free CHIP Optimal Diet Guide copy today and begin to disarm type 2 diabetes. Just go to our website, chiphealth.com/Plant Pure. It will give you an overview of which foods to increase in your diet and which foods to decrease in order to manage, no, not just manage, but to begin to disarm your diabetes. It's all in your hands. How do you use these special tools? Fork and knife. Blessings.